Hi guys, it is Dr. Shelley and I am coming to you live. It is Friday, August 20th, 20 uh 20 sorry guys, 2021, and it is 4 p.m. on Friday. So I am coming to you as I have come every single week since pretty much the beginning of the COVID pandemic to give you the latest information. Now, I did just get a message pop up saying that my internet is not optimal, and so hopefully you guys are doing okay. Please send me a smoke signal up if the transmission is not good, and I will see what I can do to make it better. Um, I am a physician and board certified gynecologist. I specialize in anti-aging wellness. I also do a lot with bioidentical hormones and minimally invasive surgeries. My office is located in Claremont, Florida, which is 20 minutes west of Orlando. And therefore, when I come to you live every week, I try to give you those national statistics, but also concentrate on Florida, which is home and where the majority of my patients hail from. Even though now with telehealth, and even before we have patients that come from as far as England via telehealth, and that see me at least once a year. So I'm also have a master's in public health and maternal and child health. So obviously the health of the public is very near and dear to me. Let's go over the statistics as we do every single week, and then we'll talk about what has actually transpired over the last week. And as we know, it's all about Delta. I think I told you I'm coming to you now. This is obviously not my normal background. I'm actually here in Marco Island, Florida. And so I thought I'd give you a little bit of different scenery, which is why my Wi-Fi is not as good, because I am sitting out on the balcony, and you can see the water outside. And so even though we are in the middle of a pandemic, the Mother Nature still prevails and can still be beautiful. And you can find comfort in that this earth will continue to go around, and that it will we will persevere through this pandemic as we have through every other crisis that our world has been hit with. The data, we're at 210 million cases of COVID worldwide and 4.41 million deaths. Recovered 189 million. In the United States, we're at 37.2 million cases of COVID with 636,000 deaths and 30 million recovered. The lineup following us as far as the country still stays the same, with India having the next most cases, followed by Brazil, Russia, France, UK, and then Turkey. And is once again the death toll in Brazil, even though they have less cases, their death toll exceeds India's at 573,000, whereas India's is 434,000, and ours, as I said, is 636,000. As far as vaccinations go, we are looking at 24% of the world is vaccinated at this point, fully vaccinated. And that's actually huge. I know that doesn't sound like a lot. And yes, there is a lot of work still to be done. But considering that less than a month ago, that number was dismally low, this is actually a very good status to be having. The Within the United States, we have, as of last week, we have crossed over the 50% percentile of fully vaccinated. We're now at 51.7%, so definitely closer to 52% than we were before. So, every person that gets vaccinated is a blessing at this point in fighting off this COVID pandemic. But obviously, we know that originally our goal was 70%. Now, with this extremely more contagious variant, our goal is actually even higher than that. We're looking at 80 to 90% to be able to contain this virus. So we're still behind, but if there's any silver lining here, it is that the number of people that are reaching out to get vaccinated has increased substantially over the last few weeks and will continue. But of course, there is a lag time before people are fully vaccinated. Um, as far as data here in the United States, which of course is always our primary interest, California still has the most number of cases at 4.2 million. Texas is 3.4 million. Florida is 3 million. And then New York is 2.3 million. Deaths over 65,000 in California, 55,000 in Texas, and 42,000 in Florida. Um, New cases just yesterday, we're looking at 155,000 new cases in California, with excuse me, in the United States, not in California, for California, within the United States, and 967 people dead yesterday from COVID. And I had actually a friend's husband die of COVID yesterday. So that person is very real to me. When you look at these statistics, it's very easy for you to think, oh, well, that's just a number, but that number has a name and a family that is actively grieving, and who I'm grieving with. So you have to understand that these are real people that are dying, and he was 45 in good health. So this is real people. It's not a hoax, and it's not something. These are families. These are aunts, uncles, children, spouses, and it is very painful when it hits home. And I hope that for you in your house, that it doesn't take someone close to you to finally make you see the light if you're one of the people that is not believing that this is real, or if you have family members that don't believe it's real. Within California, there were 90 new deaths. Texas is having, as we know, the southern states are in extreme crisis, and Texas had 209 deaths by itself yesterday. Um, Florida, the numbers are hard to record in Florida. It says there were only 8 new deaths in Florida. So if that is correct, we are happy. But I do not know. We have been having trouble getting accurate data out of Florida. Excuse me one second. The um, Within the area where I live, Orange County, we have 182,000 cases, 40.4 thousand in Lake County, and it's hard to get the actual data, like I said, because the reporting index is not as good as it used to be. All right, guys, give me 1 second. I kind of my daughter is actually at a uh, testing center getting a COVID test, and so she's asking me if my insurance is going to work for her to be able to get tested. So that was a little bit of had to take care of that, because I am, as I said, I'm not necessarily a technical person, or I'm a physician, and I'm a mom, and I'm a wife. So those things actually do trump. So anyway, speaking of children, speaking of children, I have a daughter, like I said, and she is a senior in high school, and we get calls before. Uh, um, Last in the spring of last year, we were getting calls with the regular COVID variants. We were getting calls almost every single day with 1 to 3 kids out of a school size of over 5,000, but only half of kids matriculating. So we're talking about maybe 2,000. And we were getting calls every 1 to 2 days of 1 to 3 kids out with COVID. The school's been back in session now we're finishing up week 2, and we're getting calls of 2 to 3 kids at a time out. And then we did get an alarming call yesterday where it wasn't just that it was a child in the school, but it was actually a child in my daughter's class. So this is, like I said, here in Florida, at least, it hits very close to home very quickly. And so, um, so to speak on our children and our data, because it is back to school. Like I said, here in Florida, our kids are back to school, but maybe where you're located, they aren't back to school yet. Let's talk about data, because of course there's all this controversy about wearing a mask or not. And I'm very, like I said, I try to keep things factual, and this is a medical disease. COVID does not care what your political persuasion is. It doesn't care if you're rich. It doesn't care if you're poor. It does not care if you're black, brown, yellow. It doesn't care. It's just looking for host. And the sooner people understand that and understand that this is not, a socialized disease, the better we will be. And the bottom line is we just had three big, there are three senators that just tested positive who are fully vaccinated. So this thing that masks do not make a difference is not true, because they are some of the biggest proponents of not wearing masks, and they now have COVID again and are now spending thousands of dollars getting monoclonal antibodies for something that they have that should have been prevented. So it's about prevention as it is with anything else, and prevention is always cheaper to than treatment. So you must realize that. And this is your money. These are taxpayers' money that is being spent for all of this stuff. So, when we say the government is funding, I don't, that's our money that helps to fund the government. And the government then funds all of this stuff that's happening. So monoclonal antibodies are wonderful. I just had to pay. I just had to send a prescription over for, once again, an acquaintance's daughter who's in her 20s, who is not doing well, is home with COVID, is on day 8, and had to receive monoclonal antibodies yesterday and get oxygenation today at home, trying to stave off going to the hospital. Whose oxygen rate is falling. So this is real, as I said. Within the United States, the hospitalization of children is at 1,900 as of Saturday. That's 4 times higher than it was at the beginning of July. These are children. We're talking children under the age of 18. Within Texas right now, they have over 235 children in the hospital. The amount of children being diagnosed with COVID right now, we're at 93.8 thousand children that have been diagnosed, as we're up from 8.4 thousand in June. So we're talking about a massive amount of increase, tenfold over the space of 2 months, maybe two and a half. So this is real. In Florida, we have over 190 children in the hospital currently. The ICU beds are filling up in the children's hospitals. The ICU beds we talked about already last week nationwide are filling up, especially in the critical states here in the South. Alabama now has not only no ICU beds, they have what they call a minus 11% deficit, meaning there are 11% of patients out there right now in the state of Alabama that should be in an ICU bed and can't get in one. And unfortunately, that results in death. If you need to be in ICU care and you cannot get that care, that means that you're in a critical state. And without that care, unfortunately, a lot of those patients will die. And so we're going to start seeing the death toll follows 2 weeks behind the crisis area, because it takes a while, unfortunately, for that to occur. And even in the best hands in an ICU situation, we're losing patients. So you have to understand that if they can't even get to the best care, then that's a problem. And people are being shipped out every single day, whether it's being airlifted, being driven, loved ones driving across state lines trying to get their loved one into an ICU bed or into a hospital, period. I have acquaintances where they're trying to keep their child at home because they know that once their child goes to the hospital, they're going to be sitting on a gurney, and they feel like that maybe they can give better care at home where they're at least watching them 24 hours versus having them where they're short-staffed and then maybe they're not actually getting the care that they could be getting at home. But of course, excuse me, excuse me, the problem of being at home is if your loved one needs oxygen and they do not have access to it, then being at the hospital is, you have to be there. You have to be there. So don't keep your loved one home if they really need to be in the hospital, because you may be, unfortunately, compromising their chances of survival as well. So I know we don't want to go, but sometimes you have to go. And you have to do what's best for the person that's there, even though it's very scary. Um, the so the when we one of the controversies that's had about wearing the mask is that um, children, if they're wearing masks, that it is stunting their developmental the development because they're not able to see expressions and learn and stuff like that. There've been studies, they actually have studies out there from before COVID. There was a big study that was done in 2012 following children that, with mask versus not mask. And children are, one thing that we have to remember about children is children are very resilient, and they are able to do amazing things. They can adapt. You know, we're the ones that are dinosaurs. We're the ones that are set in our ways. Children can adapt to many, many things. And so to put things in perspective, first of all, so yes, babies learn by looking, but we're not asking you to mask your baby anyway. The masks are not even recommended under two. We just recommend that you keep those kids safe and away from people that may be infected. Um, but 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 children that are school age, they actually, if you actually pay attention to what you do when you're talking to someone, like I do a lot of aesthetics in my practice, and when I get my clients in, they will say, "Oh, I want to fix this wrinkle," or "I really don't like, the wrinkles on my forehead," and they don't necessarily pay attention to the we call them crow's feet or the wrinkles um, around their eyes. And I always tell them, if they're bad, I say, "Where are you looking right now?" And then they will say, "I'm looking at your eyes." And I said, "Yes." So when people are talking to you, they're looking at your eyes. And so when we look at ourselves in the mirror, we may notice the lines here or the lines here. But what people notice is this. Why? Because we look at people's eyes. So guess what? Even with mask on, people, you're looking at their eyes. And I have been obviously dealing with this. I deal with clients all day long, um, you know, um, Monday through Friday, and on emergency situations on the weekend as well. And masked or unmasked, I can tell you, I know exactly what they're thinking, exactly what they're saying. I can pick up all of that. The mask doesn't hide a thing. So it is not a danger for children. Also, remember that in a lot of Arab nations, masks are a norm. Women walk around and they are covered. And those women are not developmentally stunted. The Arab nations, a lot of their children are highly educated. So don't feel like, those kind of excuses don't hold water. And then we talked about it a little bit last week as far as fear of or concern of uh, it making it difficult to breathe. It doesn't make it more difficult for you to breathe. And actually, for people that suffer from allergies and asthma, it actually has decreased the number of asthma attacks and hospital admissions. We saw a marked decrease in flu and which is influenza, and RSV, which is extremely dangerous respiratory illness in children last year and the year since COVID began, because children have been more sequestered and they've also been wearing masks. And now that we are in the Wild West, where everybody's, the kids have been unmasked and they are being exposed to this Delta variant, we're also seeing a marked uptick in RSV, which is much earlier in the season than we normally see it. And that's weighing down the hospitals as well, because those kids can become severely ill and need to be in the ICU. So you've got COVID patients needing the ICU, and now you've got RSV patients needing the ICU. And they're nearing capacity, like I said, in a lot of the pediatric ICUs, and we haven't even reached the fall yet when we're going to be in crisis situation. So we're going into crisis situation now. And unfortunately, it is going to be, as I always say, it's a travesty when we lose anyone. But when we lose a child who has their whole life in front of them, it's even more devastating. It on a a wider thing. It's always devastating no matter how old that person is. So I'm obviously negating the life of anyone. But as I said, children, we just feel like they've got so much more of their life to live, and so when they lose it prematurely, then obviously that is very upsetting and very concerning. Um, the and the other thing is, when you have to realize, like, say for example, I just told you that my daughter just got a call and said that there was a child in the class. Now they are actually doing a contact tracing, and what they're currently doing, because our kids are masked, um, there's a 30-day mask mandate for at this point, and they'll reassess based on what's going on. They, instead of quarantining the whole class down, at this point they are actually quarantining the children that were in that near radius that they feel were directly exposed to that child. So far we have not gotten a call from the health department, but like I said, my daughter is getting tested as we speak, even though she is fully vaccinated, and because we are being as careful as we possibly can with that. So when someone sends their child to school, what we have right now in Florida is they have what they call a parental exception. So if the parent decides that in their infinite medical wisdom that their child should not go to school for whatever reason, then and go unmasked, if that child has COVID, they're not just compromising themselves. It's not just your child, it's everyone in that classroom, and it's that teacher that's standing there too. And we all want our kids to go back to school. We do that definitely. Having our children socialize is extremely important. I have an only child. She thrives from being around other children. And so, yes, I want her to be in school. And that's what I tell her when if she complains about the mask, I say, would you rather get quarantined and be put home? She will be devastated if she gets that call and she has to sit out for 10 days because a child in her class has COVID. She is going to be devastated because that means no football games. That means, everybody else is doing what they want to do and she's stuck at home again. So realize that there are repercussions to what's happening. It's not just your child, it's all the other children around who want to be able to stay in school and not have things affected. Here in Florida, there are school districts where they are um, getting decimated, where I don't want to tell you, I don't want to say the wrong county, so I'm not going to say, but there is a county in Florida where they're seeing like a 43% of their school is being affected. So, I mean, you have to close down. You have to, these people have to go home. So when there's exposures, it affects the school. And the very thing we say we want is not going to happen because the children are going to have to stay home as well as the staff. We talked about last week the fact that elective cases are being canceled. Here in Central Florida, we can't, one of our hospital systems hasn't done elective cases for um, now over a month. And our other hospital, I had to cancel cases last week. I can do outpatient surgical cases. I have a couple of cases that are already in the books. That at this point, if things maintain stable for the next week, I will be able to get those cases done, God willing. But then after that, I'm not scheduling any new cases, and I have very patients who need their surgeries and want their surgeries and can't get them. But having oxygen available and bed space available for COVID patients is very important. One of the hospital systems here in Central Florida, they're at 38% of their hospital. Entire hospital is full of COVID patients. The ERs are brimming. Um, the and the 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 numbers are, as I mentioned before, the ICU bed numbers are what are concerning to me. Even though, as of now, the CDC has not said that the Delta variant is more virulent or more dangerous, just that it's extremely contagious and therefore it's more contagious than the common cold. I can tell you, looking at the ICU data, that this disease is affecting people. We know it affects them faster. So you can, the average person that is exposed is getting symptomatic within 3 to 4 days compared to 4 to 8. And also they are becoming severely ill faster and they are dying faster. And so it definitely is not um, a I think that it is a more virulent disease because I'm looking at the ICU bed situation. And even at the height of COVID and both crises back in January and in July here in Florida, we did not see the ICU bed numbers. They never were above 40. And we're now at 80, over 80 in one hospital center. And so I've been watching that hospital's data all along. I can see it. And we've never had this many people in the ICU. So this is ICU. These are COVID patients in the ICU. These are not just everybody in the ICU. These are actual ICU beds being filled with COVID patients. So it definitely appears to be a more virulent disease, and also taking care of clients that are calling in that have COVID. Like I said, I'm seeing a more severe severity of symptoms in these patients. So it's definitely something to be very much aware of. So as far as um, so we've got all that, so yes, I'm not trying to be the voice of pure negativity, and so I always try to look for a silver lining in everything. And I think that the main thing that we have to do now is to to say, my thing is this, is that everybody makes mistakes. We all make mistakes, but learning from our mistakes and learning how to go forward with this. And that's why my presentation is called Living with COVID, because COVID's not going away anywhere and anytime soon. And if we don't get enough people vaccinated, we're going to continue to see variants. And some of the variants are going to be really, really aggressive because they're the ones that went out, right? And so wimpy ones won't go far. And so we can see this happening over and over again, unfortunately. And so one of the positives that we're seeing is that the vaccination rate is going up significantly, especially in the states that are highly affected, which is a very good thing. It's sad that it's taking it to hit close to home, and I think that's what's happening in Alabama and Mississippi. People are seeing their loved ones die and become severely ill. And when you see your child sitting in an ICU bed or even in the hospital, it changes your thought process pretty quickly. I can tell you right now, like I said, I have people close to me that are unvaccinated or are getting ill, and the family's paying attention finally and getting vaccinated. The problem is it can be a little too late, because remember, when you get vaccinated with especially with the Moderna and with the Pfizer vaccines, you have to wait. It's 2 weeks after the second injection when you have the immunity that were the numbers that we're quoting. And remember, with the original COVID variant, we were talking about basically 92 or higher percent prevention rate of COVID. Now with the Delta variant, it's down anywhere from 72 to 82% when you look at the statistics. So that means that yes, 72 to 80%, 2% people will be protected against COVID. However, that means that there's 20 to 30% almost that will not and will actually get COVID. Luckily, most, as we've said before, most vaccinated people, most, not all, most vaccinated people will get mild disease if they get or no symptoms. However, there are people that are vaccinated that are ending up in the hospital. However, over 90%, did you hear me? Over 90% of the cases in the hospitals are unvaccinated. There's a lot of misinformation out there. I've heard a billion people telling me, no, I heard it's unvaccinated people. That is not correct. End of discussion, period, dot. Ask them to show you the data. There is none. I can tell you, I can go up to the hills, not here because I'm in Marco, but I can go to my hospital, which is almost walking distance from my office, and I will tell you 90% of those patients sitting up there are unvaccinated. And I was just up in the hospital. Unfortunately, I had an emergency case and they did go through. So do realize that emergencies are still emergencies. And if you need to be in the hospital for an emergency, you need to go. And so I did have an emergency surgical case and I did have to go through the hospital. And I actually walked in a hallway that is adjacent to the emergency room to get where I was going, heading into the hospital. And I had to go through patients on either side of the hallway that were on gurneys in the hallway. And I'm fully vaccinated and masked, and I use colloidal silver up my nose several times a day. And I held my breath going through there and was not happy at all that I was potentially risking exposure. And I pray to God those weren't COVID patients. I'm hoping that the COVID patients were actually in seclusion, and these were regular patients that couldn't get a bed because the COVID patients were taking up the isolation beds. But I didn't stand around long enough to ask that question. And I can tell you, I walked around the building on my way out of the hospital to avoid going down that corridor near that emergency room. So it's, I take it very seriously, even fully vaccinated. I am not even trying to get any kind of exposure, because even whether I get symptoms or not, that means that I am quarantined for until I'm cleared, and I don't want to be down. I don't want to be ill, and I don't want to be unable to access my clients who need me. And I certainly don't want to potentially spread it to anyone else. So what am I doing, and what do I recommend for those of us that are fully vaccinated and want to know what the safest plan is because it does get a little confusing. So what I would tell you is that, like I said, I'm here in Marco Island. This trip was already planned, and we are here actually to spread ashes for my one of my best friends who passed from cancer earlier this year, and the so we are spending our time outdoors. We all got vaccinated. I mean, vaccinated. We've been vaccinated. We all got tested, even though we're vaccinated, and that's why my daughter's getting tested besides the exposure at school. And to say that we are not carrying anything before we came together, and it's two households coming together. And we are spending our time outside. I've stopped eating in restaurants again. I stopped that a couple of weeks ago, and I am masking um, around any kind of crowd, whether it's outdoors or indoors, and definitely indoors. We've never stopped masking in the office because, once again, healthcare settings were it's always been the mandate that we should maintain masks, and we've also kept up all of our um, uh, cleaning, disinfecting, all of the things that we were doing before. Um, so that was never a change in the office, but as far as how I'm handling myself outside of the office, and we will be, so we still go, we get food from the restaurant, and if there's outdoor seating and it's spaced sufficiently apart and I feel comfortable, then we will sit there and eat. If not, we will, once again, we're back to goes, and utilizing more, once again, of delivery compared to going into the stores, um, and just but that's the great thing is that, once again, we've been through this before, so it's actually not that hard to do again. You just kind of have to say, oh, I know what works, and so this is, I just adopted back in, and you just do it. And the beach can be safe as long as you're not huddled in. And our beach, as you can see, it's actually gorgeous, and you can always get, ask for what you want. I mean, I'm very clear when I go into a restaurant, I will ask for the specific booth I want. I will ask for the specific table. And when I go down to this beach, I will ask them to set up some beach chairs, and I will not be near anyone when I do that. And so you can get what you want. You just have to be vocal about it. You don't have to just go with the flow if and you can say it nicely with a smile. And of course, when I get into places like this hotel, the villa we're staying in, I wiped everything down. I don't trust anyone else to do my cleaning but me, so I do walk around with disinfectant wipes pretty much anywhere I go. And knock on wood, that's the best you can do. And that's what you do. You have to live your life. COVID's not going away. You can't bury yourself in a hole. If you are unvaccinated, I am recommending that if you are still refusing to get vaccinated, that you do consider, especially if you're in a hot spot, that you start resuming your quarantine-like behavior, because pretty much this is going to become a disease of the vaccinated or COVID positive. It's not going to be, you're not going to have three camps. You're not going to have vaccinated, unvaccinated, and COVID. You're going to have vaccinated and COVID. And so this thing is more common than common cold. And if you're unvaccinated, you're going to get COVID at some point. 9 times out of 10. And so it's just the level of the severity of what you get. So just be aware of that. And I am going to let you guys go. I've actually talked longer than I thought I was going to talk, as always, because I like to talk. But anyway, I hope that I'm sorry if I've been fire and brimstone. I've tried not to do that. But unfortunately, there's not but so much positive data out there, besides the fact that there are people that are suddenly, finally waking up and smelling the coffee. Um, let's see. Christy says we have a Disney cruise coming up mid-November, and we're trying to figure out what to do. I would wait. I think that so the short answer is, of course, cruises are a little bit, cruises are bad because of the fact that, it's hard to separate in a cruise ship environment. And it just takes one person with this. Like I said, it's extremely common, and they have seen some of the cruise ships where they're seeing some outbreaks. And so I don't know what's going to happen, but you got till mid-November. You still got a little bit of time. This is August. And so I would just make sure that you are able to check with the cruise company and find out, with Disney, what the cancellation versus postponement would be. And as long as they say that you are able to, like if you're getting close to that window where you have to cancel and or go forward with it, then I would consider, you're asking my personal opinion, I would cancel it at this point. But if you can leave it open, until you get closer to the date and cancel or postpone at that point based on what's going on, then that's what I would do. Um, I think that I am praying that we are going to see at least this Delta variant hopefully start to, at least in Florida, because it will have run rampant before that, that hopefully we're going to start to see a decline by the beginning of November. That's my hope. Of course, I'm not taking into the fact that um, we're going into the fall. However, it was interesting because I was talking to, actually, you guys know Dr. Um, Ban, Ban, Banyan was on with me a couple of weeks ago, and what she said, which I thought was interesting, is that Florida's summer is everyone else's winter, meaning that in Florida, because it's so hot outside, we Floridians go inside in the winter, I mean, in the summer, whereas everywhere else, when it gets cold, everybody they so up north, etc., they go out in the summer and then they go inside in the winter. So for Floridians, that's another reason why we may see an actual decline as we get into the cooler months for us, whereas other states will probably see an uptick in their cases. So, long story short, keep your window, find out when you can cancel. That's what we did with this. We rolled all the way up and we could have canceled at the last minute and or at least postponed it. But we knew that if we did, we would not get back in because actually still here in Florida at this point, people are still going forward with their vacation plans. And so the resorts are packed. You cannot get a reservation at a lot of resorts. So let's see, Bahamas just closed. Hold on, let me see what it says. I can't see it. Hold on one second, hon. Yeah, yeah, and I think that that's so. What Christy said was that the Bahamas just closed their doors to ships starting September 3rd until November 1st. That's what I was saying. See, they thinking like me. I'm saying, like I said, I think they were thinking that it's going to be about November before things start to come up. If you could postpone it until the spring, I think that would be the best thing. Like get through the whole, fall flu, etc. system, and then get through the holidays when once again we're going to see an uptick because people are going to be going stir crazy and want to go visit people. And so I would think that if you could get on the cruise ship in February or so, that would be the best time at this point. That's just my prediction. I can't tell you for sure, but that's what I'm seeing. Or just like I said, yeah, that's my recommendation for all it's worth. Okay. And one other positive thing that we mentioned last week, I'll mention again for people that you know who are just staunchly anti-vaccine, but are just specifically anti-COVID vaccine and not necessarily anti-all vaccine. They are seeing that there might be a little bit of improvement with people that get the flu vaccine. So if they've gotten a flu vaccine before and are willing to get it, at least encourage them to make that step. And at least it's a little something, but not to say that they're going to do that and it's going to actually give them full, make sure they understand that it just may give them a little bit of protection, but we're not saying that it is actually in place of the COVID vaccine. So anyway, I am going to bid you guys adieu. I've got a beach waiting for me, and I hope that you are able to enjoy your weekend. Just please be safe as always. Your health is my number one concern. Have a great weekend. I will see you guys next Friday at 4 p.m. Take care.